Why don't we go ahead and kick it off? Probably a couple more people will join us, but thank you everybody for coming and spending time with us today. This is our workshop for the Connected Wellbeing Initiative for September, titled Evidence-Based Practices for Connected Wellbeing, Perspectives from Clinical and Health Sciences. Before I turn it over to Stephen Schuler, I just want to thank everyone again for attending this, and hope that this proves useful for everyone, particularly our Impact Studio groups, as they grapple with some of the issues that we'll be talking about here today. The other thing I want to do is I do want to give sort of a trigger warning here. We want to make sure that everyone is aware that because we are discussing topics related to adolescent clinical mental health, that there's the potential to talk about things that some people might find upsetting or disturbing, such as suicidal ideation or self-harm. So if that is something that is likely to upset you, feel free to dip on out and come back later in the session. We don't want anyone to sort of be upset. So with that, let me hand it off to our host with the most, Stephen Schuler.
Awesome. Well, thank you so much, Remy, and thanks everyone for joining. I was saying in the sort of pre-time, I'm super excited for this panel because it features two people who I just greatly admire and love their work, Sharon Hoover and Danielle Ramo, who I'll introduce in a second. And really the goal of today's session is supporting the mission of the Connected Wellbeing Initiative and trying to figure out how we can create better relationships with youth and technology and youth through technology. And today's session is really focused on trying to bring some of the perspective from clinical science and clinical practice and thinking about some of the challenges we face in terms of trying to support youth as really whole people through technology, and that there's been a long history of clinical interventions and clinical practice. And we have two panelists here who do a lot of work in terms of thinking about how we take best practices from clinical science and we get it out in ways that are responsible and scalable and effective. And so the sort of structure of today's session is we're going to have a little bit of a panel with Danielle Ramo and Sharon Hoover and myself, and each kind of talk for about 7 minutes about some big picture things that are kind of top of mind for us, a little bit of moderated questions from the panel, and then move and actually bring in some of our impact studios that are doing really great work in this space, and with some sort of structured conversation with them, and then open it up to Q&A to the entire group here. Okay, so just want to introduce the panelists first. So we as I mentioned, Danielle Ramo and Sharon Hoover. Dr. Ramo is a clinical psychologist, and she's the Chief Clinical Officer at Be Health, a mobile platform designed to improve team mental health and well-being. She's also an adjunct associate professor in the Department of Psychiatry and the Helen Diller Family Comprehensive Cancer Center at UC San Francisco. I was really lucky to know Danielle back when I was at UCSF over a decade ago, and it's really great to continue to see the work that she does. She came to Be Health after 3 years at Hope Lab, which is a social innovation lab building behavior change technology for teens, and 6 years on the faculty in the Department of Psychiatry at UCSF. Her research is focused on using digital tools to understand common challenges among young people, including substance use, mental health symptoms, loneliness, and medication adherence. And some of her studies have focused on tailoring digital interventions for LGBTQ youth. So I think a lot of just experiences that are really relevant to the work that a lot of people in our group do. And Sharon Hoover is also a clinical psychologist. She's a professor in the University of Maryland School of Medicine, the Division of Child and Adolescent Psychiatry, and the co-director of the National Center for School Mental Health and the director of the Center for Safe Supportive Schools. And she currently leads national efforts to support states, districts, and schools in the adoption of national performance standards of comprehensive school mental health systems. She's led and collaborated on multiple federal and state grants with a commitment to study the implementation of quality children's mental health services, has done a variety of trials looking at things like reducing exclusionary discipline practices, restorative practice approaches, and best practices in family engagement, education, and mental health literacy. So just like two people with a wealth of experience here. I also mentioned that we're going to be featuring two of our impact studios, and they'll introduce themselves, but I want to call them out here first. So we have Peer Health Exchange and Give Us the Floor. Peer Health Exchange has created the Peer Informed Resource Hub, SelfSee, as a resource to support well-being. They have 20 years of experience leading near-peer health education programming in middle and high schools across the country, reaching over 150,000 students during that time. Give Us the Floor provides LGBTQ teens in distress with the peer positive human connection that they're often missing. They help LGBTQ teens deal with distress through safe and inclusive, innovative, and unique online peer-led supportive group chats, breaking the isolation and shame cycles that they're experiencing. So again, like two groups doing really great work, frontline work, really trying to help youth and help them through technology. Okay, so Remy mentioned this before, just a content warning about the content we might be discussing in the session. I'll also say we will try as a group to be as concrete as possible, but we will also protect the identities of the youth that we work with. And we're careful not to identify them in the details in this, the examples we share. Please also consider this in the questions that you ask. We, again, want to just make this a really safe place where we can have some fruitful conversations about the work we do, but also really thinking about protecting and centering youth at the forefront of our conversations. So I'm going to start this off actually by giving each of the panelists a couple minutes to chat through a couple questions that I prepped them with. And I've asked both Danielle and Sharon, and then I'll go through it myself to talk about what are some of the biggest challenges they see when it comes to youth well-being in this moment, to kind of ground us in what we're facing right now. What are some effective approaches to addressing this challenge? And what is one opportunity that excites them in supporting youth well-being through technology? So I'll pass it to Dr. Ramo first, and I will stop sharing my screen in case you have something you want to share there.
Great. Thank you so much, Stephen. And hello, everyone. It's nice to see you all. It's nice to see some folks who I've been in Zoom rooms with previously. Welcome to both of the organizations who are doing work every day for young people. And I'm really excited to hear more about what you're doing. So as Stephen mentioned, I am a clinical psychologist and have worked at the intersection of digital health, mental health, and substance use throughout my career. I was conducting research as faculty at UC San Francisco and then transitioned my career to work more directly on digital products. And at Be Me Health, we've built a mobile app-based mental health support for all teens. And I would say that it has been nothing but gratifying and challenging every single day to work in the context of industry, to try to create something for any and every teen, and to get it out in the world to as many teens as possible, and to show measurable impact. So in the framework around what is one of the biggest challenges, I would say I face that core challenge of how to reach all teens and make sure that our measurable impact is happening, has been one of the company's biggest challenges. But around the biggest challenge in youth well-being, I thought of actually the first thing that came to mind for me was that teens are at a unique stage in life where they're naturally and importantly testing out boundaries around independence and prioritizing different relationships than when they were younger. So prioritizing friends and peers become more important. Parents, other caregivers, and adults become necessarily sort of less important in their day-to-day. And a key challenge is that most of the stakeholders involved in bringing mental health support to teens tend to be adults in their lives who can still absolutely provide and be an incredible support system. But the core mental health support system that has tended to support youth, and certainly that brings clinical services to youth, requires parents, caregivers, or adults to be more involved than most they might be in many teens' lives today. There might be reasons why there is important boundaries around what teens talk about, what they feel comfortable sharing, and the stigma around mental health means that teens might not want to reach out to, and they tell us at Be Me that they would never want to connect with traditional mental health support solutions for certain kinds of issues, like talking about things like sexuality or gender identity, because they might be worried that a clinician or another person won't be able to understand where they're at. And their adult-based support system isn't always on the same page as they are around recognizing what they might want or need or be helpful. So what that has meant is that often digital support solutions need to prioritize teens in order to bring something that will really resonate with them and support them having improved mental health as a result. And yet it has to exist in this honestly very traditional mental health service delivery system. And there are a lot of challenges and barriers with getting digital tools out through those existing systems. Another challenge is around teen engagement broadly. So, you can make a thing and it might be extremely engaging and teens might want to use it, but often the way that it's disseminated or distributed means that most teens who need that support won't necessarily ever even hear about it. And I meet a lot of amazing mission-driven folks who can create really beautiful and engaging tools for youth, but don't have a plan or really aren't sure how they're going to best get it out to young people. And that poses a huge challenge. So, we have a model at Be Me, and I think, happy to talk more about what your models are and how they're working, but also talk through what some of those challenges are, because I think that's really an important and underemphasized part of the conversation. So next, I'd love to move on to effective approaches for addressing some of the challenges I just shared. And here I'm happy to just bring out a slide. This is some screens from the Be Me Health mobile app. It's available in the iOS and Android stores for teens. And we designed our company and our product to be teen-centric from moment one. So we prioritized having our entire platform be by and for teens. And what that looked like in practice for us was creating a solution that was co-created with what we now call our Teen Advisory Board, or our TAB. And this concept of working directly with teens was not new. It's something that when I was a researcher and had NIH and state of California funded research projects, I would assemble groups of teens to also co-create. And then the internet provided this amazing opportunity, and social media in particular, which was a medium I was working in a lot, to get teens from all around the country to give their perspectives. And when you invite them to do that digitally, it actually can open the door much more widely compared to if you just go put up some flyers near wherever your research lab is, right? So digital spaces offer amazing opportunities for teens to be part of the conversation. And at Be Me, we had this opportunity to really dedicate staff to full-time work with our Teen Advisory Board to get feedback at all stages, and to grow the board and to make sure it's as diverse as the generation is, and all have a lot of different experiences with lived experiences with mental health issues, but also be reflective beyond sort of simple socio-demographic characteristics, but have any and all of the issues that we're primarily seeing from teens on our platform. So today we have 133 members, just to give you a flavor for how big it is. We meet with them weekly on Zoom, and not all 133. We have groups that we invite each week. And then we have constant interactions, surveys, et cetera, in Slack groups throughout the week. And the other thing I'll say in another aspect of effective approaches, in addition to working with teens, is opening up our ideas about what it means to measure the impact of digital tools. So here, I don't have time to go into too much detail, but I'll just draw your attention to a peer-reviewed publication that we worked on with the Stanford Department of Medicine, Dr. Jody Prochaska, that was published in JMIR, M Health and U Health just 2 weeks ago. And I'm happy to put the link to that in the chat when I'm done. But I wanted to give you a flavor for the kinds of metrics we use in evaluating teen feedback for how Be Me was impacting their lives. So yes, we definitely want to be able to show that a tool like Be Me reduces depression symptoms and anxiety symptoms, but teens are far more excited about and willing to give us feedback around these constructs that aren't only about their symptoms. In fact, they're tired of hearing about and sharing how much their sleep is affected and how sad they are and how anxious they are. They'd rather talk about constructs like how hopeful they feel or how confident they feel after seeing something related to the Be Me platform. And those were metrics that were entirely co-designed with our teen advisory board, but also taken from the science of what works, looking at correlates of depression and anxiety and other common symptoms that teens are facing today. And around what excites me, I, of course, am happy to share a little more about what we've built at Be Me, because goodness knows if it didn't excite me, that would be a bummer, because I'm pouring my blood, sweat, and tears out to this project. So in reaching all teens, Be Me has combined the digital support that teens two things that are there for teens 24/7 and kind of really can bring something to everyone and anyone that comes to the platform. So evidence-based skills and interactive activities, but also ones that support teen-centric issues like friend fights, school stress, issues around identity, bullying, both live and online, and how to talk to your crush, things that aren't necessarily only clinical in nature. We also know from research in my lab and others that if you bring live human support to teens, or to anyone, frankly, in a digital support, it increases its efficacy. And actually, Stephen's done some really nice writing highlighting this, that if you have a live component, it makes it more engaging and impactful. So we have a live text-based coaching service. We connect teens to clinical services. And for those who need it, we have 24/7 crisis support in the form of a digital safety plan and links to crisis support hotlines and text message supports. So I think I'm out of time. I was trying to talk very fast, but I hope this gives you a little flavor for some of the biggest challenges and how we're addressing them at Be Me.
You did a great job of summarizing a lot of work in a very short period of time. I appreciate it. We'll have more opportunity to discuss and to engage. So thank you. And with that, I will pass it over to Dr. Hoover.
Great. Thank you, Stephen. So unlike Dr. Ramo, I actually am not in the primary space of digital solutions and how they interface with mental health. As Stephen mentioned earlier, my area is really in the space of how to translate mental health supports into the settings where young people are, and specifically in schools. And so I feel like I'm probably going to learn a whole lot today about the intersection of digital solutions with schools and mental health. So I'm really excited to be here, and thank you for inviting me. I do have a few slides that I'll pull up just to orient us, and I have a few let's see if I shared the right screen there. I think I did. I have a few links as well that I'll just throw into the chat box. Let's see if I can pull that up. It's disappeared on me on my screen here. There it is. All right, so there we go. So what I'm sharing in the chat now is just a link to our National Center for School Mental Health. I also, as Stephen mentioned, lead a National Center for Safe Supportive Schools, which is part of the National Child Traumatic Stress Network. And that center focuses specifically on the integration of culturally responsive, anti-racist, and equitable policies and practices, and trauma-informed healing-centered policies and practices into school mental health. So both of those links are there so that you can see a little bit about the work that I do and the lens through which I see some of this work. And I also shared the National Performance Standards link, which is just an online place where schools and districts and a lot of state and territory leaders go across the nation to kind of see how they're doing in terms of school mental health quality, and it's a free online platform. And then the Hopeful Futures campaign, I just always try to stick them in somewhere because they are doing really great policy work with states and with local communities to advance school mental health. And so a lot of what we do helps to inform their work and vice versa. So I put that link in there as well. So here's a little bit about our National Center. We've been around a long time. We've been around for over 25 years now. We are federally funded. You can see our mission here is really to strengthen policies and programs in school mental health, to improve learning and promote success for America's youth. And you can find us at schoolmentalhealth.org. And as Dr. Ramo did, I'm going to quickly touch on each of the areas that we were asked to. So just some of the challenges that I see in our work related to youth mental health and that we're seeing in the field. Effective approaches, and I'm going to focus specifically on what I know best, which is school mental health. And then I was asked to just share a little bit about what I'm excited about as far as opportunities for mental health and specifically leveraging technology and digital solutions in this space. So probably in terms of the challenges, at least in my area, a lot of what folks are talking about data-wise is, what came out from the CDC report, just that we're in a state of crisis with respect to youth mental health. So I think we've seen this now in headlines for the last couple of years. And then the data that came out from the CDC just highlighting specifically the rise in depression, anxiety, traumatic stress, reports of victimization or violence, and specific populations, specifically girls. They focused on specifically LGBTQ+ IA students, and really the high levels of not only distress, but also specific problem areas that young people were reporting, and they documented this increase over the last decade or so. The data didn't necessarily come to as a surprise to a lot of us in the field, but I think has really kind of splashed the headlines and has been, I think, a surprise to some who may not be in the field, and I think did demonstrate, kind of this urgency of mental health concerns. One of the things that stood out to us in the CDC report that came out was the statement of, how schools need to be a part of the solution. And certainly it's something that we've said for a long time. But this was, what Dr. Ethier noted in the report. She's the director of the Division of Adolescent and School Health. That young people are experiencing a level of distress that calls on us to act with urgency and compassion, and with the right programs and services in place, schools have the unique ability to help youth flourish. And the words that were chosen here, but also in the rest of the report, we thought were really compelling in the sense that they didn't only focus on kind of traditional conceptualizations of how we intervene around mental illness or mental health, or just around pathology, even though that's what a lot of the data spoke to. They really talked about the need to think of spaces where young people reside as places of healing, as places of hope, as places to promote flourishing. So what Dr. Ramo already started alluding to in terms of some of the metrics that they're using to understand how young people experience mental health interventions, we're really excited about in terms of how do we reconceptualize how we identify mental health challenges, but also how to promote flourishing in young people. And I think the way to do that in large part will require the leveraging of technology. So with respect to some of the challenges, these are just a few that I kind of dotted out as I was highlighting in my own mind. What are some of the big challenges that get in our way when we're trying to promote well-being in our young people? So we know a challenge is that rates of mental health concerns or mental health distress are rising or seem to be rising per the data that we have at our fingertips. We hear all the time that we have limited child and adolescent specialty mental health providers in the field, and certainly limited payment structures in terms of how we can support those who are equipped to provide some mental health supports. And those are the ones we hear about kind of on a daily basis in our field, I would say. But beyond that, some of the things that I think are really getting in our way are, kind of the conceptualizations of mental health that focus just on categorical kind of understandings of mental health and mental illness that really overemphasize pathology instead of thinking about well-being and flourishing. We know that there is limited use of various intervention providers. So for example, I don't think we leverage our peers very well, our young people very well. We don't really leverage other types of providers who may not be specialized or have, certificated specialty in mental health areas. And I think we're really limiting ourselves as a result. We also, as Dr. Ramo already alluded to, really kind of constrain ourselves with some of the traditional modalities of treatment interventions that exist. We have, I think, very poor and limited use of technology-supported interventions, given where we are with technology as a society. I think when we think about mental health interventions, we're still so far behind. We don't see, I was excited to hear about Dr. Ramo's co-design and design lead by youth, but I think we're still very limited as a mental health field in terms of how well we co-design and create and implement youth interventions. And, certainly in school mental health, but I would say across child mental health broadly, there's a limited investment in culturally based interventions that really lift up the practices within specific cultures and communities. And kind of piggybacking on that, I would say interventions are often not tailored to unique populations, even though we know that there are unique population needs and assets that we could tailor interventions based on. And often in terms of how we invest in mental health interventions, the emphasis is on intensive interventions with a very limited investment in promotion and prevention. So those are things that were top of mind for me. As far as solutions, one that we often talk about, and this is not kind of an intervention, but rather a framework for how we can translate mental health supports to young people. Comprehensive school mental health systems is a term that a lot of folks are using now. It really reflects this multi-tiered system of supports offered in school settings and in partnership with community partners and students and families. The idea being that if we can offer tiers of support, all the way from universal supports for all young people to more intensive supports in the school setting, then we're able to do a number of things, including some of the things you see here. So providing access to mental health supports where students are, access matters, building social emotional skills and mental health skills of all students. And that can be by way of mental health literacy, so kind of infusing mental health into the curriculum, by way of social emotional learning, again, kind of classroom or school-based activities for all young people. And then finally, and this is really what the CDC report got to, promoting connection and inclusion for all students. So that's what our second center focuses on, the safe and supportive schools focus. We know that belonging matters to promote mental health. So how do we leverage schools to do that? What does it look like on the ground? This is a really busy picture, but this is just one state's illustration of how they're doing a multi-tiered.
Oh no.
Show some of the actual practices. Go
You've
ahead.
Sharon, but you're back.
Oh, did you lose me?
Just for 1 sec.
Oh, goodness. Okay. This is from Massachusetts. This is what it looks like on the ground. Thank you for letting me know. Yeah, I did just get your connection is unstable sign. So hopefully that won't happen again. I'll just mention that, doing this work in schools is really critical, especially even when you're thinking about just from an access standpoint. If we're thinking about mental health interventions, we know young people are much more likely to access them if they're offered where they are, often in the school setting. And as far as kind of what is most exciting to me, again, because digital, the intersection with digital is not my area, it's not my academic focus. I was thinking pretty broadly here, just the idea that I'm excited about when I see opportunities like what Dr. Ramo mentioned, where we're working with youth and having youth lead solutions to promote well-being for all young people and to intervene early as challenges arise. but particularly doing so in collaboration with schools, right? So that could be, and we've seen efforts, especially recently, to leverage technology for mental health literacy, for example. So where we're not just having like an hour of mental health in ninth grade health curricula, but rather, we're seeing more and more states actually require mental health literacy K through 12, even pre-K through 12 and beyond. And so how can we better leverage technology to do that? And when we think about the social emotional learning requirements across a lot of states, how could we leverage things like gaming and virtual reality and other technology-based solutions to actually promote that instead of relying on some of our more traditional methods? So there's lots of ways that I'm excited about how technology can be more infused to school mental health, but those are a couple other broad ways. So I'll stop there, Stephen, and pass it on to you.
Awesome. Thank you. Well, I have a couple slides that I will share and answer these questions as well. Cool. So in terms of challenges, I think, one challenge I think we're really facing, and this is something that Tom Insel talked about in his most recent book and kind of framed as the 40-40-33 rule, is that that we have a big mental health challenge. And I think that we've heard a lot of conversation in the media and elsewhere about the current youth mental health crisis that has been going on for a while. And data suggests that we have about almost just under 8 million kids in the US who have a diagnosable, and I think this is also worthwhile pointing out, and treatable mental health condition. So it's not just we can diagnose them, we could treat these mental health conditions. We have effective treatments. And only about 40% of those with a mental health condition receive any treatment whatsoever. But even if we look at those who are treated and receive services, only about a third benefit, a third receive no benefit, a third receive some benefit, and a third receive full benefit and actually get remission from that mental health disorder or challenge that they're facing. And so I think one thing that we underemphasize when we talk about this is we can't only focus on access. A challenge is we really have to focus on the quality of care the kids receive. It's not just about getting kids into care. It's about getting kids into care that's actually going to help them. And we owe it to kids when they get past all these barriers. And Dr. Hoover and Dr. Ramo talked about some of the barriers to getting kids into care, parents as gatekeepers, just having enough providers out there. There's a lot of barriers. We owe it to people when they get through all those barriers that they're met with quality care that can actually help improve their lives and improve their mental health. So I think that's a major challenge, and we have to think really, I think, critically about quality. In terms of approaches, the work that I do is really focused on using technology to scale and improve access and accessibility of mental health services. So I lead a project called One Mind Cyber Guide, where we sort of review different solutions that are out there. We actually put out last year a guide to different solutions for teen mental health that provide some review of what was out at the marketplace at that time, but also just some of the use case around this. I've also worked on developing a lot of different interventions that try to distill some of the effective practices from other areas like cognitive behavioral therapy. So on the left-hand side of the screen here, this is a project that was not specifically youth-focused, but was a collaboration I did with Mental Health America, where teamed with their screening platform that screens thousands of people a day, many of them being young people. We've developed this little platform called Overcoming Thoughts that will allow people to do sort of brief interventions based on cognitive behavioral practices, cognitive restructuring, and behavior experiments. And I think what's really been interesting to me over the past couple of years is that we've seen that brief interventions in various forms can be really effective. And Jessica Schleider at Northwestern University has done a really nice job demonstrating this through some of her work on single session interventions. And so I think that, when I talk about quality, that doesn't mean we need to get everyone into long-term psychotherapy. And, Dr. Hoover made this point around prevention and other sort of methods. I think diversifying the toolkit is a really great idea. And different things will benefit for different people, and, things work. It doesn't just have to be psychotherapy. It doesn't just have to be long-term services and supports. So I think that's something that we've seen in terms of clinical science and clinical practice is lots of different things can be effective. In terms of an opportunity, I want to highlight something that's been touched on by both of the other panelists, which is really working with young people, I think is really where we need to be. And I think that technology provides not just an opportunity to provide services and provide interventions and provide outreaches, but it's also a really great way to allow kids to really guide us in terms of what we can be doing and involve them. And so I loved hearing about this panel that they have at BME of these 133 youth advisors and meeting with them on Zoom. And we've done this in some of our own work, actually working with Lease to America, who's here as well. We did a project where we were trying to get feedback on different mental health apps that are out there, engaged some kids from their network on Zoom calls, as well as Discord and other opportunities to just allow them to give us some feedback on different things so we can know what they were interested in, what they thought was useful and why. And I think that that's a really important opportunity, is that we not just build for kids, but we build with kids. And with that, I'll actually kind of switch gears here and just do a little bit of questions for folks on the panel. I'd love actually to start with you, Dr. Hoover, and maybe just hear a little bit about maybe what you're hearing from the front line of kids and educators. What are some concerns they might have with technology, or excitements that they have technology, that you're hearing from kids and teachers and other people as you interact with schools themselves?
Yeah, so I mean, it's interesting. I think during distance learning, when so many educators had to learn and adopt new technologies, they were, not surprisingly, I think, stressed and burned out, many of them, by that prospect, and really struggling with the technology, and young people as well, in terms of having to try to, many of them at least, do distance learning through technology. So I think with the return to at least much of learning being in person, there is, and we've seen this in some of the education-focused writings, that educators, not across the board, but many are reluctant to adopt new technologies, in part because of kind of a rebound from having to learn and adopt new technology during distance learning. So that's just one piece. I think just in general, in terms of new programming, whether it's digital or not, school educators are often, and especially school administrators, are often reluctant to take something on unless they feel like it's going to have staying power. And I think technology-based solutions can be a little bit uncertain for some of our education leaders, right? Is this going to be an app that comes and goes? Is this something that will stay for the long haul? So again, I think for both of those reasons, we hear, just in terms of conversations that we have, and also just the education literature, there is some skepticism among students. Certainly, we started in some of the research we did with telehealth. We consistently heard, and the literature supports, that young people and families reported enjoying telehealth and finding it as acceptable and satisfying in all the measures that we use as in-person supports, if not more so, because of the convenience factors and even some of kind of the protective factors for young people. They felt that they were a bit more protected sometimes if they were able to use a technology-based intervention solution. So there was enthusiasm, I think, around some of those. Yeah, and I'm just trying to think in terms of some of the app-based solutions that Dr. Ramo mentioned. Our young people, I would say, when they find something that feels suited for them, and often those are ones that are co-designed by their peers, then they're likely to engage with it. But we hear a lot that things are developed for them that are clearly developed by adults that are out of touch with what their experiences are. And so I just think it's a failed strategy if we're trying to move forward some of these technology-based solutions without having young people really driving the solutions. So those are some initial thoughts, Stephen.
Yeah, and I think maybe to bounce off of that, like, I know in the work we did with Listo, like one thing that we kind of heard from the kids that was obvious, that these solutions were not built for them or with them, was that the problems that were brought up were not the things that they saw as problems. So I loved, in your presentation, Dr. Ramo, like some of the stuff that you're doing about like the problems that kids are actually facing, like breakups and procrastination and getting into college. Like these are things that are top of mind for them, and like so few of these technologies touch on them. Maybe are there other examples you can think of from your own work, Dr. Ramo, that an example of something that you've done that you heard from the youth that really made it like youth-centric in terms of what you guys were doing?
Yeah, so a core one is that I mentioned Be Me is designed with a lot of different types of features, including digital features and live human connection. And we're able to incorporate what teens are bringing to our platform into growing and adapting the platform so that it better suits their needs. So 2 examples are our coaching service was designed in collaboration with our tab, who said clearly that they wanted options in coming into coaching. They didn't want to be fed a couple of topics like depression or anxiety, like some of the mental health types may have designed, right? And I'm purposefully making fun of my field in that context to highlight that might be something that we, I won't make assumptions, Sharon, but definitely our field would pathologize in the way we would even think about what teens' mental health experiences are. And so we might frame up like, do you want to talk about depression or do you want to talk about anxiety? So knowing alone, so it's starting not from a pathological framework, but then also that teens sometimes knew exactly what they wanted to talk about when they come into a connection like coaching. And so they can just type in anything when they come to talk to a coach. And from that, we get, what are these topics that resonate most with them and are, frankly, they're not always things that are really devastating or harmful to them. They might just be things that they're curious about and they don't have anyone else to ask. And good examples of that are, how do I talk to my crush? Or, that's a really common one. Lots of stuff with social relationships and potential romantic relationships. How do I make new friends? Lots of stuff that highlights loneliness, but they wouldn't necessarily call it loneliness. Again, that might be the word that mental health folks would use, but they want to say, I just started a new school and I don't know how to talk to new people or whatever it is. And so getting it from the teens lens and then being able then when we have popular topics and we pop things up on our app, having it be that teen-centric language that they've already been bringing is going to resonate even more. So that's one piece. And then also looking for what teens are searching for in our content to, again, see how they're talking about various emotional and other kinds of experiences in their life. So like one basic example is they don't often search for depression or anxiety, but the word overwhelm is like something that resonates very, very strongly with the teens coming to Be Me.
That's great. Those are some great examples. Something really struck me in Dr. Hoover's presentation, talking about the need for like tailored interventions and thinking about uniqueness to population. And I often think in our field, there's a tension between evidence-based and how do we think about what does that mean in populations where maybe there has not been as much research done or that there are not evidence-based interventions. And so, I'd love maybe to start with you, Dr. Ramo, and see if you have any thoughts on how you kind of think about what to do when you're working with a population or group where maybe there's not a lot of evidence, or how do we think about evidence-based practices or the adaptation or the tailoring that you have to do in the work that you do?
Yeah. So I spent years in my research lab at UCSF focused on tailoring interventions to queer youth, which was a population that was near and dear to my heart as a queer person and a queer mom. And there, we can talk about queer youth being vulnerable and underserved in a lot of different ways and for a lot of different reasons. And we did find that digital spaces that were created by and for queer youth resonated really strongly in that population, and even more so than spaces that were more diverse, like that sense of community. If you're able to create a sense of community within the digital context, it was really impactful for queer young people. So I took that with me when I came to Be Me, and we weren't only working with one, cultural identity group, but lots. And in fact, purposefully, we're designing something that was for all teens, which, boy, that's a lofty goal, right? And those of you who are also working on groups that are for any and all teens, you have to find this balance of like, how do you speak to teens that will get something more out of a cultural experience where their identity is reflected in others in groups, and when it's okay, or how you handle also wanting to meet the needs of a lot of different types of youth and make maximum impact. So there's no right answer to that. But I think the way we've handled it at Be Me is one approach, and something to consider, which is that there are spaces within the Be Me platform for content around exploring identity in certain ways, for, let's say, teens who identify as female, or teens who identify as trans, or teens who are adopted, or teens who are recent immigrants to this country. And there, in that context, there will be areas and ways that they can interact with content that was co-developed by other teens who have similar experiences as they do. But it's not limited to only a space with folks who have certain identities. So again, that's how we're handling it, and then continuing to get feedback, and also, doing formal evaluations with groups of teens who are in these vulnerable identity groups to make sure that the tool is resonating with them, and find out how we can improve. And that also speaks to things like making sure, in the context of like LGBTQIA+ young people, like making sure there are chunks, more than just a couple teens in our tab who reflect those identities, who can give us honest feedback, like, tell us what sucks. That's really important.
Great, thanks. Dr. Hoover, you lead a national effort to help schools, and those schools are diverse, and you also try to bring out evidence-based practices through technical assistance. How do you think about the role of tailoring and adaptation and the work that you guys do through that network?
Yeah, I mean, it's that tension, I think, that Dr. Ramo spoke to already, about when you're trying to serve broad swaths of students and educators, how do you ensure that you are trying to tailor? And part of it is just being really intentional that different people and different communities and groups of people may have different strengths and needs, that we need to ask about, not assume. And so a couple of examples come to mind. We do a lot of work with the Ministry of Education up in Ontario. And, we were asked to help co-design some school-based interventions for their newcomer refugee and immigrant youth. And there was an assumption made out of the ministry that they really wanted to use existing trauma interventions in schools. And so we really had to back up and start from a place working with the newcomer students and families, asking kind of what is their definition of what it means to be mentally healthy, and how do they see schools as being a part of that solution. And they really shifted course following a lot of those discussions with newcomer students and families to start with an intervention that didn't initially ask about trauma, that doesn't focus primarily on trauma response, but rather focuses on connection, well-being, some of their journey. Instead of a trauma narrative, they developed what they call a journey narrative, talking about the migration experience. Similarly, they have a program called the 4th R that they adapted for use with their First Nations youth. And it is really quite rooted in the cultural practices and routines within their First Nations communities. And part of it, again, was backing up and starting from a place of, what do we mean by mental health? And for both of those interventions, it really is not at all focused on depression, anxiety, trauma, some of the things that the mental health field is traditionally coming in with evidence-based intervention. So it's really thinking about reconceptualizing mental health using the definitions offered by the communities we're serving. So, but it is a balance. It doesn't mean throwing everything out. We do have evidence-based practices where there may be components that can be incorporated. The newcomer work, for example, we have pulled from some cognitive behavioral, skill-based coping skills, et cetera, that are infused, but it's done in close collaboration with the newcomer communities and students and families.
Awesome, great. Well, I want to bring in our two impact studios. So I want to start with Give Us the Floor. And so Give Us the Floor team. Would you mind? I gave a little bit of a brief intro to you at the top of the session, but maybe just introduce your project and your team, and maybe highlight in that introduction like a challenge that's top of mind for you and the work that you all are doing.
Yes, hi. So I'm happy to do it. Can you hear me? Okay.
We
So
can.
I'm Valerie. I'm the founder and CEO of Give Us the Floor. So what we do, you explained it very well. We help LGBTQ young people in distress via supportive group chats. They are groups on our app, Give Us the Floor app. They're groups of 12 to 15 to 12 or 15 of them. And then no more than 2 years between the younger one, the older one. There's at least one trained facilitator, trained peer teen facilitator on it, and they are supported by a group of what we call adult advisor, which are here, Kelsey and Courtney. They have extensive mental health clinical experience and are equipped to respond to crisis when we have teams that are in crisis, and also support the facilitators. There's also with us Catherine, who is the strategic partnership manager, and she's also has an extensive background in youth at risk. So our top challenges, I would say, are probably when they are crisis. It's the wellness check. Is when do we decide to do a wellness check? They are like processes that we're supposed to follow that are very clear in the mental health feed and youth at risk organization. But sometimes we want to know that a mental a wellness check can be more harmful than no wellness check in some kids, because their home are not affirming them, no home are not supporting, and sending the police can be worse. So that's really a big struggle when it's like, what over or like how can we operate around that? It's like sometimes can we decide to not do a wellness check because we think it's better for the individual, even if they are really at big risk of being hurt. So that's our first big issue. The second one, I would say, is when we have kids that are repeatedly talk about suicidal ideation, self-harm, being abused, or other really hard stuff that they bring in their group. They need help more than we Give Us the Floor can give them, but it triggers the other member of the group. So we cannot let this individual keep bringing this triggering thought conversation in the group. And it puts us in a situation where at some point we have to remove them from a group, but then we cannot remove the only support that they have in life. So I think that's already, and I think Kelsey and Courtney can really talk more about that, but that's really our two biggest challenges.
Maybe, Dr. Hoover, do you want to kind of speak to that first, and some of the things that you guys think about through the programs that you do and help supporting schools think about supporting the safety of youth responsibly, and then maybe pass it to you next, Dr. Ramo, and see if you have anything to add, and specifically thinking about how to do that digitally, which I know is another sort of added layer of challenge.
Yeah, I mean, and certainly is something we think about a fair amount in terms of our Center for Safe Supportive Schools. Like, what does it actually mean for students to feel safe? There's the immediate safety concerns around self-harm, harm to others that I think are, standardly talked about and addressed as we're doing mental health supports with young people. And it does, that is one of the things we've seen actually as I would say, a real obstacle with some of our school leadership in terms of adopting new digital interventions, because they fear that they're not going to be able to as easily assess for that kind of safety. At the same time, there's kind of a whole other layer of safety in terms of students feeling connected, emotionally safe, psychologically safe, and physically safe in their school space, right? And so interventions that we can do to promote that level of safety, that's kind of a different category of safety that I think we need to be concerned about when we're talking about mental health interventions in schools. But in terms of the former, like the safety and how do we assess for it and address it in the context of mental health interventions, and specifically digital ones, one of the things that we have encouraged schools to do, for example, in the context of telemental health, is really have kind of safety leads in the school building, for example, so that if there are digital interventions that are in place, we're not relying on people who don't feel that they're equipped to support mental health assessment or mental health safety procedures in a school, that you really have a few folks in the school, and it may be a health professional, it may be a designated student support professional, who any educator who's going to be implementing some type of mental health support knows that they can go to help assess for the student safety. For telemental health, for example, there may be a designated space where students can receive telemental health supports, and there's a person in the school who can kind of facilitate that and go through essentially a checklist of safety with the students before, after, but also go over those protocols with the students. So I don't know if I addressed all the questions that you mentioned.
I mean, I'd like Kelsey to jump in. I think not quite, because Kelsey and Courtney are at the background to be able to assess that. The problem is that sometimes you're sending the police or somebody to the home makes the kid in a less safe, because their parents will go after them more if they are abused by their parents, for example. Yeah. That just not sending. Kelsey, you want to talk a bit about that?
I will try and speak as quickly as I can, because I do have to go to another engagement.
Oh, right, sorry.
The issue is that we really focus on anonymity. So that brings up another issue. When we get messages about an individual being in crisis, saying things like, I am having these really triggering thoughts and I'm considering following through with it, and they're not necessarily open in the moment to make a safety plan when we're addressing them. At that point, it's really on us to make the decision of, okay, this individual cannot keep themselves safe, so we have to help them stay safe. And that's where the wellness check comes in and CPS comes in. But we've also had situations where we do let them know right from the get-go, we are mandated reporters. If you're struggling to be safe, then it is our responsibility to help you be safe in that capacity. So those are the areas that we find the most challenges of. This individual is telling us that they cannot be safe. We're hitting all of the avenues: safety planning. Do you have a support person? Do you have a support community? Is there anyone? And a lot of the individuals we talk to don't. We're it. So at that point, we're the last line of ensuring their safety. And that's the issue of, it causes a lot of distress, but at the same time, we need to ensure their safety. And that's where the challenge lies. I hope that clears it up a little bit more. I would love to stay, but I do have to go. Thank you so much.
Thank you, Kelsey.
I'm sorry.
Go ahead, Dr. Ramos.
I was just going to say, I'm sorry that Kelsey won't benefit from, the further conversation. And if there's if there's an interest, if they'd like to connect after, that happy to, but just want to validate for a second that the issues you're raising are ones that we deal with every single day at VME. And the challenge is when you open up support, in a way that helps teens feel comfortable and perhaps provide a space that they don't have in any other part of their lives to share some of their struggles, those issues around safety are bound to come up. And the what digital spaces do is it democratizes access, which means you're getting folks who wouldn't otherwise share in other clinical settings. And there's a comfort with sharing in digital spaces that this generation is expressing every single day, right? The social media companies have had to address how they handle and manage that. And let's just say they're not mental health companies, right? But I'd say by far, you know, companies like TikTok and Meta and others have had to navigate that they have access to all this information now. And but they don't have that obligation as part of their company's mission to address it. When you have a company that does have that mission associated, which all the organizations here, including mine, have, it is naive to go into this space without having a plan for broadly how you're going to handle that kind of stuff. It would be naive to set up a supportive space without knowing and that you're going to get to crisis, have legal obligations, and have clinical issues come up. So I can't say what the plan should be. I mean, I think about it every day, and I continue, you know, I work on it at BME. But I think, and it sounds like you all have clinical expertise as well, because that's key, right? You can't do it without. But having to strike that balance of doing interventional work that a teen might not understand would happen when they agree to something or go into a digital space is par for the course, and has to be, we have to just, you know, what you're doing sounds right, which is making sure they understand that there are limits to confidentiality and letting them know that they, you know, if they share certain things, there are legal and ethical obligations to intervene. But, you know, I just want to validate again, these are tough issues. Mm-hmm. And it doesn't stop me, you know, and I don't think it clearly doesn't stop you from wanting to be that supportive space, but eyes wide open.
Mm-hmm. Dr. Hoover, do you have something else you want to add in there?
No, I mean, I think what Dr. Ramos said from the digital perspective, you know, how do you try to convey your, you know, how you're going to navigate complex safety issues when a student is entrusting you with, you know, confidential or what they, you know, would hope to be confidential information. How do you balance that with ensuring the safety to the extent possible? And, you know, we know that there's harm done, as Valerie mentioned, when sometimes when we bring in Child Protective Services or other law enforcement, certainly in circumstances and in, you know, whether it's because we're mandated reporters or just in an effort to promote safety. So I don't have a, you know, a key a solution here other than, you know, we know that it's a challenge that we're all trying to address. And I think being as transparent as possible up front with young people about kind of what we are required to share and ways that we're able to support them through the process. And certainly from a clinical perspective, when we do have to engage, let's say, Child Protective Services for safety reasons, we try to do so in a way that where we're able to establish relationship with the family as we do that outreach, so that we can do so as much as possible in relationship with the family, so it's not as, you know, potentially harmful or disruptive to the child.
You know, I'll just maybe add in, I've been in a lot of conversations where people's solutions, because they don't know what to do, is just not to ask and not to collect that information. And that breaks my heart, because that means that there's kids in need who are not getting help. And if we don't ask, it doesn't mean they're not experiencing it. And I think that there are effective things that we can do to help support people. I think also people at different sort of range of needs that they have. I think, you know, we've brought up in some of our different conversations, like there can be brief preventative, you know, interventions, things that can still help them. And I've seen some very impressive, very brief things that are useful, even for people experiencing suicidal ideation or self-harm. And so I think that another thing I just like to reinforce to people is, like, not asking is not a solution to me. And I think that we have to make sure that we open up spaces for for youth to share these things and to ask, because that does save lives, and it helps protect people and helps make, helps kids be mentally healthier. So it's been a real issue I've pounded on a lot recently, is we can't just not ask. We need to ask, and then we also need to make sure then when we ask and we know, we meet kids with things that are effective and helpful to them. So
yeah, I agree. The thing is that sometimes it's not that helpful. That's where we sometimes struggle, because, for example, when you have a kid that is, I mean, it happens not a long time ago, that is abused physically by an adult in their family. Sometimes you do a CPS report, right? But it most of the time takes a bit of time to investigate. And if you send the police right now, because they talk to us, and it's like my father is totally drunk, and we're like locked in the room, but he's gonna come. So and it's like sending the police. Often the police would just stay at the door and the father up and say everything is fine, and then they would be even harder on the kids. So it's this kind of situation, though, and I agree. We love to share that, but I don't think there's much solution. We still have to do what we have to do to try to make them as safe as possible. But sometimes we just have the impression that we're making things worse for them in a short term, I would say, because CPS, and if it's an adult, if it's 18 or over 18, CPS doesn't even address them. So we're in a totally different situation.
yeah, well, and I think it also just highlights the need for all the work that everyone in this room is trying to do, and it's a place where there's a lot of kids are in situations and places that are really challenging and complex, and so it's great to have people who care and are able to come into those situations to try to impact sort of meaningful change. I want to also open and bring in Peer Health Exchange. So, again, I introduced them at the top of the session, but maybe give us a little bit of introduction to yourself and your team, and same kind of questions starting out, like what are some of the major challenges maybe that you're facing that are top of mind for you right now?
Yeah, thank you so much. This conversation has been so rich, and when we think about the barriers, I'll dive into that, but really I'm not going to share anything new. I think we've covered so many of them, and it's refreshing to know we're not alone, but it's also very disheartening to know there's still so much work to do. But I admire everyone in this space. Dr. Hoover and Dr. Ramo, thank you so much for sharing your wisdom. I'm over here taking copious notes. But my name is Unitra Rutledge. I am the Director of Distribution for Peer Health Exchange. So in my role, I work to share Self-See, which Stephen mentioned earlier. It is our health resource app that is co-designed, co-created with young people. It is a safe digital space for youth seeking resources, stories, and support for their mental health, sexual health, identity, and beyond. Our platform really prioritizes youth voice. So again, co-created with youth and continues to be co-designed with youth. So whether it is vetting the resources, the videos that you see on Self-See, all of that is continuously with our youth design group and or our digital storytellers. When I think about the challenges in the things that we are talking about, particularly in this conversation, creating that safe digital ecospace is such a huge topic and such a huge responsibility. And to Dr. Ramo's point, the folks here have taken the onus of that and said, we have to create this safe space. But we also know that the internet as a whole is not a safe space with social media and all the things that's going on. And then Dr. Hoover, you mentioned, changing that digital innovation in schools and letting schools know that there are some safe spaces for young people in regards to digital innovation and how to make that more broadly accepted. I would say that's actually one of the challenges that we are facing is with the schools and it being okay for young people to go on a website that's not blocked or restricted and have access to the information. So when we think about the gatekeeping that is happening, that young people are telling us, hey, we want access to this information. And if they can't get it at the schools, they're spending 8, 10, 12 hours a day at school How do we effectively combat that and make it comfortable and safe, not just for schools to say young people can use these resources at school, but maybe to your point about having those key people there that are a part of the solution on campus to kind of guide those practices. The other thing I was thinking about is just being mindful of creating those identity affirming resources. I think Dr. Ramo, you touched on that, and just understanding that there is this cross-sectional identity with young people, and it's not just one layer. Young people are multi-layered. And so we're consciously thinking about how do we make sure that we are representing young people's identities. So you'll see it come up in our videos. You'll see a representation of young people across the board in all of our youth groups. So just kind of keeping those things top of mind. But I'm curious to know, I think we've like we said, we figured out here our responsibility. What are some things that we could share with schools or with other stakeholders to share these resources that would be key in kind of changing their mindset and changing the conversation to move towards a more positive outlook on a digital safe ecospace?
I love that question. And I'm so excited. I was pulling up your site and digging into it a little bit. So I'm excited to learn more about what you do. It looks fantastic. If I could, Stephen, sorry, I just jumped right in without your facilitation.
I love it.
All right. But I did just want to say, I mean, I think that part of, it is a very complicated education policy landscape right now in terms of mental health and creating safe spaces in schools, especially for people with different identities, intersectional identities. People, are really creating, literal firewalls and barriers to people being able to understand and explore and affirm their identities in school sectors right now. So it's complicated, but I think in terms of how to shift the conversation really presenting the life-saving nature of giving young people affirming space digitally, and that by not doing that, we are actually putting young people at risk, in terms of their safety, their health, their academic engagement, right? So if we think about academic success being the bottom line for schools, right? They want students who are attending, who are graduating, who are doing well, they're performing, et cetera. We know that coming to school relies on students feeling safe. We know them doing well in school. So if there's some way of using data to inform school administrators that when we put up firewalls, electronically, for example, to students being able to feel affirmed and feel safe, then we are actually limiting their ability to effectively be ready for learning and to engage in learning. And I know that that's a steep battle to make that argument, especially in some education sectors right now. But I think having the data to back that up is absolutely essential. And I think also one more quick thing, there's a lot of movement towards digital citizenship curriculum in schools. And I think if we can infuse within that digital citizenship and kind of the policy making around what's included in that content, again, using the data for how creating safe and affirming spaces for youth is essential to their well-being, their health, their lives, their academic success, that will hopefully shift the conversation.
Actually, can I just ask a quick follow-up on that, Dr. Hoover? Because I think one thing that's been interesting in some of the spaces I've been in is that I'm not an education person or an ed tech person, but I've been brought into some of those more conversations, and it feels like there's more of an appreciation of trying to think about sort of mental health more holistically in school spaces, especially after the pandemic. So I'd be curious, are you getting a sense of does that seem like it's coming up in the digital citizenship conversations that you've been in? Do you see some change there?
Certainly, but we're also seeing a loud but very, a small but very vocal minority of folks who are shifting policy against the inclusion of mental health in education. And so, I think the voice for including mental health, whether it's in digital citizenship curriculum or just in the education curricula more broadly, is not as well organized. Like the lobbying voice, the education policy activists are not as well organized as some of the lobbyists against including social emotional learning, mental health into education, if that makes sense.
Yeah, for sure. And I've heard some similar things in other places as well. Social emotional learning, who knew it was going to be such a hotbed topic, but a term that activates a lot of people in different places.
Yeah.
Can I add one quick thing? I think understandably, school administrators are concerned about liability, right? So as soon as they are being asked to be responsible for bringing a digital tool into their schools, they think about things like what happens if a teen is unsafe or has a negative consequence as a result of that, and it's on me or the school as a result, right? So we have to know when we're going into these conversations that that is their frame, and that that is a frankly rational and understandable reaction to their position, right? So in shifting the conversation toward resilience, well-being, and having an investment in a digital tool like Self-See or one of the other ones we're talking about can be supportive to youth, I have found that shift around what measures are used can really be helpful ways to frame up the conversation. Like if we can show that teens who use BeMe feel more hopeful after using BeMe, rather than a framework that BeMe reduces their depression symptoms, which we might also be measuring and might also want to show, that will frame up to school administrators that, yeah, hopeful kids are happier, they have improved well-being, they make it through the school year, they stick around for the next year, you know, those kinds of things. And goodness knows if you can prove those things, that's amazing, but that's usually the next step. So, you know, framing it up in what measures you might use in your tool or what you might ask of teens in your groups afterwards, can really help share a conversation with school administrators so that they see real opportunity.
Awesome, great, thanks. I want to, Unitra, you mentioned another thing in your question that I thought was something we had talked about previously, which was this idea around thinking about identity affirming content and inner work that you do. Daniel has a hand raised too, so we will go to Daniel's question after this.
Sure. I was wondering if the recording stopped because we were going to get into the serious part of the conversation. I thought that was a great point about intersectional identities of youth. And I'm smiling because there are aspects of intersectional identities of adults that we don't understand still and haven't built into our interventions very well, right? So there is a lot of nuance there around how to make sure or even measure whether people find that a tool resonates with them, whatever their identity may be. Around the youth space, I think managing that, one important characteristic we bring at BeMe that I brought after years of doing this work was sort of humbleness, not making assumptions about what teens' identities would be or what a certain identity means. And, you know, there's so many identity categories I could bring up as examples like I did earlier, but just looking simply at queer youth, you know, we could make all sorts of assumptions about what kinds of content or intervention material queer youth might want to see. But you pretty much cannot do it successfully unless you are asking them alone what that even means. So starting there, and that's just one identity term, right? That's not even addressing intersectionality. But there's, I would say, everything from kind of direct adaptations, like thinking about in our content, things like considering intersectionality in images and word choices that we use, to language, you know, the kinds of language that we use, and making sure it's not just one term or terms, and having youth themselves come in and make videos about what it means to be a queer person of color, for example, or, you know, there's just so many examples I could bring up to show the diversity of experiences. And so just continuing to build out that diversity, and because frankly, that's what teens tell us they want to see. And that's what they're getting in places like TikTok, which is frankly what is taking their attention from a supportive tool. It's not the textbook that they have at school, right? It's this place that they have access to far, far more diverse types of material, like spaces like TikTok.
Great, thanks. Daniel, you've patiently had your hand raised, so maybe we can go to you.
Yeah, thank you. This is such a rich conversation. For context, I work for Common Sense Education, and I'm part of the digital citizenship team, so I create the curriculum. And I actually have two questions, which we might not have enough time to discuss. But my first question was for you, Dr. Hoover. We've been trying to integrate digital well-being and mental health into digital citizenship and how we communicate digital citizenship to districts. And honestly, we're having like a hard time with, and it's not like a hard time, like people are not interested, people love the idea. I think the issues are with implementation. So I'm wondering, do you have any insights or suggestions around best practices? I feel like one of the challenges that we have is we are taking evidence-based, clinical practices and then having teachers be the facilitators, people who don't have clinical training. So how do we bridge that gap? Like, that's like to us, like the biggest roadblock that we're facing. That's one question. And then I had one for you, Dr. Ramos, sort of related to the point that you just brought up. When we were creating our digital well-being content and we interviewed our youth advisory council, one of the main areas of concerns that they had was self-diagnosis that comes from being on platforms like TikTok and Discord. And so when we talk about issues around co-creation and being culturally relevant, how do we take into account like the digital culture that kids are building on these platforms, and how like the potential negative impacts that they might bring to like the development process of an intervention? I know it's a lot, but
those are great questions. I'll quickly try to answer the first one, and then Dr. Ramo the second maybe. So as far as the first question, I don't have a lot of experience in terms of implementation of digital citizenship content in the curriculum, but I do have a fair amount of experience with mental health literacy curricula and implementation of that. And to your point, a lot of educators don't feel equipped or supported to deliver that content. And so how do we get them to a place where they can feel supported? Part of it is that they are worried that, that if they open up a topic and then get confronted with, students who are really struggling, that they may not feel supported to do that. They don't feel that they're coming in with that content knowledge, et cetera. The way we've seen it be successful in terms of implementation is to start, typical implementation support, start with your kind of early adopters, your key opinion leaders, those folks who are eager to implement. This is not always a feasible approach because it may be something that needs to be done school-wide or grade level, et cetera. But if you can get some of those early adopters or key leaders who do feel more comfortable or who want to get comfortable with the content, and then have them essentially serve as mentors, provide coaching, demonstrated teaching. We've also had co-facilitated curricula for mental health literacy, where we start by having a mental health clinician or trainer facilitate with an educator until they get comfortable, and then they serve as a mentor for other educators. So it's sort of a cascade model of training and implementing. I'll pause there.
And in 30 seconds, I'm happy to share one quick answer to your big question about how you account for the digital community influencing the Gen Z around their ideas of mental health and various conditions. And we take that into account as best as possible when we co-create content with young people that we work with. And that includes oversight from mental health professionals around how material shows up for things like depression and anxiety, but also, to use a relevant example from TikTok, dissociative identity disorder, which, for a little while, every teen may have thought they had. And, I'm joking a little bit, but the point is that, when they hear it, they start to think, understandably be influenced by some of the content that comes in spaces and travels quickly in spaces like TikTok. So we're not asking young people to just create content for us around mental health without giving them guidance and having true collaborative interactive processes. And we're not making assumptions that they know or understand the science of that intervention, but we're also trying to make sure that they have leeway around their own experiences and what supports and what works for them, and having a mix of both clinically directed content and more free content that would not be as immediately tied to clinical issues feels like kind of the right balance. But it's always a work in progress. Great questions.
Awesome, great, thanks. Well, we're just about out of time here, so I want to thank our panelists. This has been exceptionally useful. I've learned a bunch, which is one reason why I appreciate both of these amazing scholars and developers and implementers, because I learn a bunch every time I listen to them, and really appreciate the contributions also from Peer Health Exchange and Give Us the Floor, and everyone for coming. I asked Remy to keep track of all of the links that were shared in the chat, so we will send those around to people and follow up. And yeah, thanks again so much for attending our session. Remy, is there anything else you want to say in closing here?
Just thank you to everybody, and we will be letting you know soon about the scheduling for the October workshop, and we'll also be doing some events related to connected wellbeing for the Connected Learning Summit this year, so keep an eye out for that. And the Connected Learning Summit is in October, and registration is open, so thank you, everybody.